Hi there, my name is Christopher Mark Gordon. I'm a physiotherapist, osteopath, naturopathic practitioner and clinical scientist, and the inventor of the fascia releaser and the deep releaser. I have a private clinic in Germany since 1990, specialized in stress and pain treatments through the methodology I've developed called the interdisciplinary fasciotherapy. Just for a very simple explanation, IFT is based on two different working systems or working areas. One is the myofascial bodywork, where the discipline and the understanding of the science of the myofascial system is understood, and also the self-regulation through the autonomic nervous system. For this reason, as a self-help tool and a therapy tool, I've developed the fascia releaser. And the deep releaser has been specially designed as an add-on which can be used separately but can also reach different parts of the body like the neck and the lumbar spine or torsion shearing on the legs. In this video you will learn how to use the fascia releaser and deep releaser to treat your arms and hands, and to help you do this, my trainer Carmen Graf will guide you through this process. In this video, physiotherapist and naturopathic practitioner Carmen Graf will show you how to use the fascia releaser with deep releaser to treat your hands and arms. Especially in office workers, the arms and the hands are often affected by monotonous and repetitive movement patterns and are prone to damage and strain. The following treatment techniques can be used both preventatively and curatively. Have fun with the self-help tutorial. To prepare yourself for the treatment, oil the lower part of your arm to increase the tissue's gliding property. Wipe off excess oil with a towel. Set the fascia releaser level to number 1. Cross your legs and place the relevant arm on the upper leg. Start your treatment with a warm-up exercise to enhance blood circulation in the tissues. Perform small strokes with moderate pressure on all sides of your arm. In this stage, you may use one of the curved sides or one of the edges of the fascia releaser. During the warm-up exercise, bend your hand downwards to create forearm stretch. Note that on a pain perception scale from 0 to 10, you should always work in the range between 4 to 5. Continue your treatment with the deep-acting vibro-shearing technique, moving from the wrist upwards. Place the edge of the fascia releaser at a 45-degree angle on the tissue and stroke slowly and deeply towards the arm bend. Treat all sides of your forearm in a similar way. Omit the wrist and the arm bend from your treatment. Do never exceed the value of 7 on the pain perception scale from 0 to 10. During your treatment, you may perform micro-movements with your hand. Especially in office workers, the arms and the hands are often affected by monotonous and repetitive movement patterns and are prone to inflammation, tension, and tissue damage. This often manifests in a repetitive strain injury syndrome, also commonly known as the mouse hand syndrome. Further well-known complaints are, for example, the carpal tunnel syndrome or tendinitis. Treating your arms and hands with the vibro-shearing technique can have a preventative as well as a curative effect on such symptoms. It should be noted that the tendon insertions must be excluded from the treatment, so in particular the wrist and the arm bend. Now treat your hand fascia with the deep releaser. For preparation, unscrew one of the 2 deep releaser attachments. Place the relevant hand on the tip of the attachment area and start stroking the lateral towards the wrist. Then perform strokes from the spaces between your fingers downwards. Treat your entire hand palm in this way, always moving from the outer part of the hand towards the wrist. To increase the pressure of your treatment, you may also place the deep releaser on your thigh. Use a small towel as a base to prevent the deep releaser slipping away. Treat your palm in the previous way, but with increased pressure. By doing so, you can reach deeper tensions in the muscle fascia tissue. Lastly, but not least, you can also trigger point with the deep releaser. Trigger points are small rice grain-like adhesions that cause pain and can radiate into wide areas of the body. Use the deep releaser to treat such points deeply. Build pressure on specific points and treat yourself with small circular movements to release the adhesions and tensions.
Would you like to professionalize your self-help treatment and take it to a new level? In our online seminars, we show you how to do it. Learn the releaser treatments directly from the inventor and benefit from decades of therapeutic and scientific experience. Besides, you will learn how to integrate the autonomous nervous system into your training to enhance the therapeutic effect of your self-help treatments and to develop a calm focus for improved stress resilience. Take a closer look